Hello everyone, welcome back to my channel. My name is Sultan. For those who already know me, I'm an ST3 histopathology trainee in East of England. In today's video, I'll be talking about histopathology interview preparation. I will give you some useful tips to use and talk about some high yield points that will make the interview process a lot easier for you. I'll also be talking about my interview preparation crash course, which I'll leave a link for registration down in the description below. In my interview, I managed to get around, I think it was 78 or 79% score, which is considered to be quite on the high end in UK interview scores. Anything above 70 is considered really, really well. I have not met anyone who ever scored above 80. I'm sure some people might score that high, but just to give you an idea of how the interview was for me. So hopefully I can pass down some useful tips to allow you to get a very high score on your interviews as well. So I'll break down this video into 4 parts. In the first part, I'll talk about the purpose of the interview, what is the goal for the interview, why do they do interviews, and in the second part, I'll break down the main components of the histopathology interview, and in the third part, I'll speak about useful mnemonics and some high yield topics for you to read about to prepare for your interview. Most of these topics are repeated, not just in histopathology interview, but generally UK interviews tend to follow the same layout, and there are some topics that they always keep bringing up. And lastly, I'll talk about some useful resources and briefly talk about my interview preparation crash course. So I'll be assuming that you have applied for histopathology, you've passed the long listing, short listing, you've gotten an invitation for your histopathology interview, you've booked it, and now you are in preparation mode for the interview. So if you're wondering what all these terms mean, you should probably watch my video talking about histopathology application, where I break down each step and each point about the histopathology training application process. So let's get right into it. Let's start with the first part. What is the goal of histopathology interview? Why do they do it? So the interview is going to start with a standard ID check confirming your identity. So you should have your ID or passport ready with you to show. So the purpose of the interview, to check if you have the right attitude, to check your enthusiasm and motivation in pursuing a career in histopathology. And they also want to check if you are going to fit in the team. Are you easygoing? Are you flexible? Essentially, they are looking for a colleague. The interviewers are people who you will potentially be working with. Histopathology is a small knit community, and many people actually know each other in the histopathology community in England. So when the interviewer is talking to you, they want to know, am I looking forward to work with this individual? So all of that is actually quite easy to achieve. All you need to do is relax, always smile, well, naturally smile, wear something professional for the interview, and just be yourself. So part 2, what are the main components of the interview? The interview is now a 30-minute interview divided into 5 different stations. These, they don't typically signpost these stations. You just start the interview and they kind of ask you the questions as you proceed through them. These stations sometimes change and they do update this information from their website. So I got this from their website, which I'll try to leave a link down below as well. So let's start with interpretation of an image. They're going to show you an image and they'll expect you to describe it for them. They're not looking for a very, very detailed description, but rather they're looking to see whether you have some sort of system that you're following. So you can start with a general inspection of that image and then work your way from either right to left, outside to inside, like peripheral to central, up to down, does not matter, as long as you follow a pattern, a system. So you need to describe it systematically, and then at the end, put everything together, quickly summarize what you've seen, and then give your interpretation and summary of what you have just described. Second part, histopathology as a career. Typically, they would want to know why you want to do histopathology. examples of team working, examples of you in a team working scenario. They might give you some scenarios and say, how would you participate in that scenario? How would you manage in that team? Usually in that part, it's good to be able to train or practice on describing yourself, talking about your CV, talking about why you want to do histopathology, thinking of examples where you were part of a team and how did you play a role in that team. And then clinical knowledge skills, they will give you a couple of clinical scenarios, and they are usually medical clinical scenarios. I would recommend that you become familiar with the common scenarios which you can find in one of the chapters, I believe, in Oxford Handbook. I'll leave an image of the book I'm talking about somewhere here. And just be familiar with very, very common medical scenarios such as anaphylaxis, sepsis, myocardial infarction or ACS, DVTs is actually a good one as well, common infections that you might find in the hospital and how would you manage, perhaps diabetes and DKA. So as you can see, the commonest scenarios, the most prevalent scenarios that you can think about, it's very unlikely that they're going to give you something very rare or very uncommon. So it's always going to be something very common. You see it, you've definitely seen a case, you've definitely treated a patient with such presentation. Be very systematic with your answer. So if it's an emergency, you do A, B, C, D, and then you proceed with if there is a flow chart that you've learned from Oxford Handbook on managing such scenario, and always be organized. So if you're talking about your management, divide them into, for example, bloods, radiology, and special tests, for example. You don't have to verbalize them. You can verbalize that you're categorizing your management in such way, but it's always good to keep yourself organized. So it's not the best impression if somebody is jumping between X-ray and then blood test and then CT and then again a blood test. So it's always good to categorize your answer in small boxes that go along with each other to make your answer flow smoothly. The next part is clinical errors and audits. They will probably give you a scenario of a clinical error or a mistake that has happened within the team, and then how would you manage and how would you tackle it. And then they will ask you about audits. Give me an example of an audit you've done. Have you ever played a part of an audit? What part did you play in that audit? And then finally, they might ask you something such as, are you familiar with the audit cycle? What do you know about the audit cycle? These are all very common questions. This is not just histopathology. That's all training program interviews. They love asking about audits and research and examples of you playing a part in those. And finally, case study. So in case study, it's not very specific. They will give you a case scenario, and then they will ask you particular questions in that case scenario. And this is like the vague part of the interview. It can be anywhere from a case report that they'd like to discuss to a post-mortem report that they'd like you to talk about. Maybe they'll talk about an MDT case where they will bring a very unique case for you to talk about. Again, nothing that is super rare. So part 3 in my video is about useful mnemonic and high yield topics. So here I'm going to mention a few high yield topics that if I was running out of time, I would just focus on these bits and topics around it, because these tend to come again and again and again in all medical interviews, including histopathology. Bear in mind, most interviews in medicine in the UK try to assess very similar things altogether. Let's go through some common or useful mnemonics. First of all, you should be familiar with CAMP mnemonic, which is clinical, academic, management, and personal. This mnemonic is very useful for questions that ask you to speak about your background. So for example, tell us about your CV, tell us about yourself, tell us about your own experience in pathology or histopathology. The initial part, C, you're going to talk briefly about your career, but be very reflective. So for example, in my clinical practice, I did pediatrics for a couple of years. And then I need to mention that empathy is a very important characteristic for a doctor to have. And then I need to give a very brief example, saying, for example, dealing with parents on my pediatric ward, I've learned a lot of empathy, communication skills. It's also even better if you can give a specific scenario. So in summary, you've learned, for example, a great deal of communication skills and empathy during your pediatric rotation. And then you're going to proceed with the next part of what you've done. Obviously, there are two ways of tackling this part. You can be chronological and saying which clinical rotation you've done first and which one you've done last. But for some who actually have like 10 years experience, that will take forever, isn't it? So they can kind of summarize it into certain specialties altogether. You can say in total you've done that many years in this and that many years in that hospital. Whichever way, it is really not important. They're not looking at what specialty you've done. They want to see what did you learn out of all these clinical experiences. Next point, academic. A, you're going to speak about, so that's A for academic. You're going to speak about all your teaching skills, any teaching initiative you've done, any research, or any, for example, journal clubs that you've joined, anything that requires you to present a case report in hospital, anything that has to do with academia, you can mention them here. Again, reflect on what you've learned, explain to them what you've done. Then the next part is management. If you have a medical example of management, whether you were a rota coordinator or you were a representative of junior doctors or residents in your department or hospital, yes, brilliant. But many people are not. So be creative. Think of other things you've done in your life, even if it's outside medicine. Last bit is personal. Any personal reason, whether it is your love for research, and histopathology is research heavy, whether it is a relative that benefited from the service and you feel like you want to give to people back. So keep it personal, but very important, keep it relevant. The next useful mnemonic is STAR. S for situation, T for task, A for action, R for results and reflection. So you will use this mnemonic for giving examples of a scenario you've experienced. So for example, these questions can be, give us an example of a mistake you've done, or give us an example of where you were under a lot of pressure. So you're going to give the situation, S, situation, and then T is the task. Let's say you're in a very stressful environment. T is that you need to see the patients, okay? That's the task. Action is that, well, you prioritize the cases that you've had into urgent and non-urgent, and then you've tackled the urgent ones first, and the non-urgent you left them, for example, to hand over, if appropriate. And then the result is that, how did that go? I've managed to see the urgent patient, kept patient safety my utmost priority. And then a reflection is that I should always, categorize patients into urgent and non-urgent to ensure patient safety. So that is how you use this mnemonic, and you can use it in any question that requires you to give an example. Then we have SPIE's mnemonic. S for seek information, P for patient safety, E for escalation, I for initiative, and S for support. And this mnemonic is used for difficult colleagues, difficult situation. These are the more ethical situations. You've seen a drunk colleague, your consultant smells of alcohol, smells of marijuana. You've seen a junior doctor with illegal drug substance at work. So these are the difficult scenarios essentially that you need to tackle. Also, you should know your 7 pillars of clinical governance. You should know what clinical governance is, and basically anything in that in any of those 7 pillars are considered clinical governance. Try to know the definition, and don't be very robotic, to always explain it in your own words. But clinical governance is a whole different topic, and it will take a very long part of this video if I sit and explain every single part of it. I think I'll leave a link down below for a web page I found which speaks about it nicely, but you can do your own reading separately from anywhere, honestly. Also know about confidentiality and how the UK like to deal with confidentiality. Many parts of the world, people phone in to take their mother's report, but in the UK, the confidentiality is a big deal. Only the patient named in that report can actually take it, unless that patient has a legal document that authorizes another person to take information on their behalf. So just familiarize yourself with confidentialities and the common scenarios where confidentiality can be broken. And very, very briefly, this can be by a court order. If you receive a court order saying, Dr. X and Y, you need to tell us the information about this person, you can break confidentiality with a court order. Or if someone's life is in danger, your patient is telling you, I'm going to leave this clinic and harm someone. So you can tell that person that they're about to harm, and I believe you can also inform the police. So there are few scenarios where you can break confidentialities, but there are very rare and few. Most of the time, you should always be very confidential with the information you get or you have in the NHS. Know the difference between audit and research. Very important. Know your audit cycles. Know how you participated and which part of that audit cycle you've done in your own audit. Know the definition of few terms, terminologies such as what is a near miss, what's an adverse event, what's the never event, what is a serious incident, or what is a critical incident. So I'm just going to very briefly, again, each one of these topics take a long time to actually explain in much detail. So, a near miss would be something that was just about to go wrong, but it didn't. For example, you were about to give a wrong medication, but the nurse alerted you and you retracted that medication and you give the patient the right medication. That's the right medication. That is a near miss. So you haven't done the mistake, but you were about to do it because the label is very similar. An adverse event, let's say a surgery was done and then patient harm happened due to surgical site infection, which could possibly trigger the question, was sterilization techniques adequate? So that's an adverse event. That's an adverse event. Then a never event is, for example, something that should never happen, like this should absolutely not happen ever. For example, removing the wrong kidney, removing the wrong organ, fixing the wrong bone, giving the medication down the wrong route. I've heard of real scenarios where a medication that's supposed to be given IV is given intrathecally, or something that was supposed to be milk was supposed to be given through an NG and it was flushed in someone's vein, IV route. So these are never events. These things should never happen, okay? And they're quite serious actually. So next is the serious incident. Serious incident is defined when serious harm or even death happens due to that mistake. Let's say if you've given the wrong medication and that medication resulted with death or serious harm, or for example blindness, some serious comorbidity, then that is a very serious incident. And usually this triggers root cause analysis, which also another event also triggers that. And root cause analysis is where a serious investigation goes into this incident, trying to find what the mistakes happened and how can the NHS Trust prevent this from happening again. Then you have critical incidents, which is a failure of systems. Critical incidents basically overlaps with serious incidents because critical incident is like a serious incident that is about to happen. Let's say critical incident example is IT failure, the computers have shut in the whole hospital, power outage, the whole electricity is just completely shut, bed blocks, there is no beds to admit patients, and so patients may actually be seriously harmed in the corridors, not receiving appropriate treatment. So it's usually where a system fails, requires urgent action to solve it. So these are the very, very important topics, and I recommend that you read around these topics as much as you can, familiarize yourself with scenario, always bring it back to yourself, something you've seen, something you've learned, and reflect. So I'd like to say at the end of this part, reflect. Always when you give an example, try to relate it to yourself. So part 4 is useful resources and a little bit about my interview crash course. My genuine opinion and very humble advice is that you should practice and always try to improve your answer, but try to be natural, don't be very robotic. And no one is looking for exact definitions or exact wording. At least in the histopathology interviews, all they care about is that, do you understand what this is? Do you understand what an audit is? And then can you verbalize it and explain it in your own words, in your own experience? And then always reflect, reflect, reflect. Whatever you say, bring it to yourself, make it more relevant rather than a Google search answer. It will be a very personalized answer, and that's what they're looking for. They're looking for genuine, honest answers. And then the book I used in my preparation is actually the medical interviews book, but this is an older version. So I'm going to put a picture and a link for the latest version of the medical interviews book. This book is actually about all specialties. It doesn't particularly talk about histopathology for some reason, but there are some very common themes along all of these specialties. And when you read it, just skip the parts where you feel like it's completely irrelevant, and then take the parts that you think will probably benefit you, because it's a very general thing about the NHS or communication skills or leadership skills. Another advice is familiarize yourself with your CV, familiarize yourself with person specification of the job you're applying to. Look at what characteristics they're looking for in that job, and then also make sure that you can read the GMC Good Medical Practice. I'll try to leave a link down below as well for all of the things I'm talking about. GMC Good Medical Practice. Just have a brief reading and try to grasp the kind of environment they're looking for from you as a doctor in the NHS. And finally, if this all sounds very difficult to you, I will be launching my interview prep crash course that you can join. I'll leave a link down below. You can go in, find an appropriate date, and then book that date so you can have a session with me where I'm going to talk about what I said in my interview and how I phrased my answers, and maybe tackle on some techniques that people can struggle with giving their answers during the interviews. So I highly recommend it if you find the interview process very scary and very daunting. So hopefully I will support you as much as I can and prepare you as much as I can for the interview. If this video offered you any benefit, please like, subscribe, share this to your friends, and support this channel, because with your support I can make more videos and hopefully benefit everyone. Well, thank you so much for watching and spending all of this time hearing me blabber. I'll see you next time. Thank you.